Hello, listeners. This is going to be a irregular but slightly different podcast that we're going to produce. Mike and I will, and it comes from a listener suggestion. Actually, I think a couple of months ago, received an email from John, who said that sometimes it'd be interesting to hear about some of the differences between the way things are done in Germany and the United States. And, Mike and I thought about that a little bit. And we actually introduced an episode that sort of tried that out. It was episode number 39. And I think it was called Trying Something Different, where Mike and I sort of talked about current events, various different ways governments do things in the two different countries, just the cultural things, etc. And we got a pretty good reaction to that. It's one of our more highly listened to episodes. So we thought we would continue that, and so we will record various different things that Mike and I talk about. And this really is turning on the record button before we typically do. So, Mike being in Germany and I'm here in the United States, when we first get on to our call with each other, we chit-chat for 10, 15, 20 minutes or so. And then we dive into the episode, and that's when we hit the record button. So now what we're going to do is hit the record button as soon as we connect with each other. And if there's something good in there, we'll release it as an episode. And you can hear it in your podcast if you'd like to listen to it. And if you don't want to listen to it, that's fine, because they will be labeled separately. We're not going to start another podcast series because we already do two of them, entrepreneurship and the sailing one. So these episodes will just be part of the normal series of entrepreneurship and the sailing episodes, and they'll be interspersed as separate episodes within those shows. So hope you enjoy them. Let us know what you think. We always appreciate feedback from all of you. And if you don't like these, then you can easily skip them because they will be separate episodes. So thanks again for listening. Good morning, Michael. How are you?
Good. How are you?
I'm well, thanks.
What's new?
As usual,
in your neck of the woods?
Good to see you. What's new?
Yeah.
Well, yesterday was almost 60 degrees here.
Oh, dear.
And tomorrow we're supposed to
good for
have
skiing.
6 inches of snow. So,
Oof.
Yeah.
Did you get skiing at all?
Yeah. We opened. They opened up the day after Thanksgiving, so late November. And I went up this week. I went up on Wednesday. Tuesday. And last week I was up on Wednesday. It was okay. There's really no natural snow. I mean, there was a little bit, in the woods, but it's all man-made snow. So if it wasn't for the man-made stuff, there would not be any skiing. It's a slow season compared to last year. But, the COVID stuff is still here. So it's sort of an awkward ski thing. You need to wear a mask when you're standing in line waiting to get on the lift. If you're riding the lift with someone else, you need to wear a mask. Inside any buildings, you need to wear a mask. So it's, and I think as last year, they limit the number of tickets they're going to sell. So they're capping their capacity. Normally, they don't really cap the capacity at all, but they're going to cap the capacity as they did last year. So, yeah, COVID is still here, big and strong.
Were people compliant at the resort?
Yeah, for most part.
Mountain?
Yeah, for the most part. There's some people need to be reminded, and most of them do it. Sometimes they roll their eyes or, they give you a look. But for the most part, people are pretty compliant. Look, wearing a mask is a pretty easy thing, right? I mean, if I look at all the things that I need to do, that are sort of painless,
especially for skiing, right? With safety equipment and all the things, right?
It's on the painless end of the spectrum when it comes to things that they're asking you to do. So I myself happily comply. If you think I should wear a mask, fine, I'll wear a mask. No big deal. And they just instituted those restrictions now here in New York State. The governor just came out this week and said anything indoors, you got to wear a mask. And either everyone needs to be masked or everyone needs to be vaccinated, but you can't mix and match. So you can't have non-vaccinated people required to wear a mask and vaccinated people don't have to wear a mask. It's either everyone needs to be vaxxed or everyone needs to wear a mask.
Interesting.
Yeah. And then, of course, I think in New York State here, the day after she made that announcement, like 10 or 11 counties came out and said, we're not going to enforce that because we don't have any resources to enforce it. Basically, the state left it up to the counties to enforce it. And they're going, how are we going to enforce it? And here again, it's this interesting thing that happens here where we bat the tennis ball back and forth across the net. We at the federal level, we want to do this shot mandate, but we're going to require corporations to enforce it and do it. At the state level, we're going to require masks, but we're going to let the counties figure out how to enforce it. Well, the state controls the state police. Why don't they have the state police enforce it? So it's
right.
It's this interesting sort of I want to get this done, but I don't want to be the bad guy in the situation. I want to let someone else have to be the bad guy.
Strategy, formulation, and implementation, right? It's been, we've been writing about that as academics for 50 years, right? Yeah. Chandler, I think it was, in like 1936, right? It was like, yeah, you have to, it's one thing to design the strategy, it's the other thing to implement it. And even the best strategies, poorly implemented, are useless.
Yeah.
So we need to go back to basics and just, all right, develop the strategy, implement the strategy. Needs to be aligned. And, here we never went away from indoor mask mandates.
Yeah.
Been in place the whole time.
Yeah. And so in Germany, does the government take an active role in sort of, here in the United States, we do a lot of things where we ask corporations to do things, right? The mask mandate at the federal level. Health insurance is fundamentally provided by companies,
yep.
Right? And so there's a lot of things that are enforced by your employer or provided by your employer. Is it the same way in Germany?
So health insurance is not. It's completely separate. So it has no tie whatsoever to your job other than work. A lot of jobs pay, give you subsidy, will pay. So like for, now I have a different setup because I'm in the civil service, but if you're just generally a regular employee, some companies will pay for part of the premiums that you pay or all the premiums that you pay. So depending on your income level. So, so that's kind of interesting as a benefit, but in general, no, it's not. It isn't flat out. Let me go back a step. It's flat out. The companies have no responsibility for health insurance at all. As far as things like vaccination mandates and things like that, so here we're not even allowed to ask if employees are vaccinated. So it's a very different approach. It's very hands-off. There are some categories of workers where I think they can, but it's specified, right? And then the employer, I guess, would enforce that, but it's pretty cut and dried. It's not, right? It's, yes, the government says this, and this is your job, and so this is what you do. A lot of the mandates here, so we've got in stores, so grocery stores and drug stores, anybody can go in right now here, but any other retail besides for that, Bela, so a clothes store, a sporting goods store, I had to pick up a picture frame last week, so I went to the art supply store, and those are, you must be either vaccinated or have here when if you get COVID, you go to the hospital. You go to the doctor, at least. You don't necessarily have to go to the hospital, but you go to the doctor, your family doctor, and everybody, of course, has one because everybody has health insurance, right? You go to your doctor checks you out and gives you a piece of paper, okay? And that piece of paper says you have COVID, and you go back after you're recovered, and you get another piece of paper that they check you, right? And they say you have recovered from COVID. So that's good for, I don't know, 6 months, I forget, but a certain period of time, right, that you've recovered. So you either have your vaccination, mine is on my phone. You can get a little card. There's a paper book, but some format, you show your vaccination, you show your ID. And again, everybody must have an ID here. It's not like the US where it's your driver's license. Everybody has a identification card. It's separate from your driver's license. You must get one. So you show that. You show your vaccination or your letter. And then they let you in. And the store enforces that. So at the checkout, they've kind of built little booths, and kind of you pass through, and they say before you go in, make sure you have your mask on, make sure you have your certificate and your ID, right?
Yeah.
And you go in and you show it, they check, they scan, everything's got a code, they scan it, it comes up, matches your license, in you go. Takes, I don't know, 15 seconds.
Yeah.
Right?
Yeah.
But everybody in that store is vaccinated or recovered, certified, right?
Yeah.
I'm sure there's been a few small fakes, right, where people have faked it, but the vast majority of, at least where I live in Germany, is highly compliant. So the companies enforce that. So I think it's a little bit of both. That's a long answer to a short question, Bela. So there are some where the companies enforce it, but there's other things where they don't need to worry about it. And even like sick days, there are no sick days. And as long as you have a letter from your doctor, you don't go to work, and they don't want you to go to work. Yeah. Right. Because they don't want you to get other people sick.
Yeah. Yeah.
And if it gets to a certain amount of days, I forget exactly what, you go over to the government's short-term disability program. And so again, and then you get paid, but it doesn't come out of the company's pocket.
Yeah.
So it's just a whole different mentality toward these things.
Yeah.
And I'm not saying it's better or worse, but it's different.
Yeah.
I totally agree with you. It's different.
Well, it's interesting.
I mean, I think it's better because I moved here, but I mean, I see arguments on both sides.
Sure. Yeah, there's some things that some people will find better, and other things that people will find not as good. But it's interesting.
Different strokes for different folks, and that's why people move, right?
Right.
To go live in a place where it's more aligned with their preferences.
So it's interesting that there in Germany, they sort of give you credit for having COVID, right? They assume that you've got some antibodies, and they're giving you credit. And it looks like the vaccine wanes too, right? That's the whole reason we're getting boosters and all that stuff. So that's interesting because they haven't done that here as far as I know. A lot of people have talked about, well, they should, but they haven't. Because a lot of people have had COVID. Right? Yep. Yeah. Interesting.
Yep. And they're always kind of adjusting. So like at first they said boosters for 6 months. And I read the same thing in the US, but they do adjust these time windows too. So they said, okay, it was 6 months, and then they changed to 5 months. And so we just got ours last Saturday. And I had to go to the pharmacy. Okay. And we have these cool pharmacies here. They're like old school pharmacies. We have a drugstore which doesn't really sell, which has no pharmacy. And that was where you can buy like bed or bath products and shampoos and hairspray and toothpaste and all these things, right? But they don't do prescriptions in these stores. Okay. If you want to get any kind of medicine, you go to the apotheca, to the pharmacy, and they have a few little kind of specialty products that are more expensive, but you can't buy like mouthwash, you know what I mean? Right. Or you can't buy normal toothpaste. They have all of the specialty toothpaste. And then and so there's some things, and then there's two classes of these kind of medicines, right? So there's one class that the pharmacist can prescribe you. So you can go in and say, oh, I've got a cold, or I have a backache, or right, I have this thing on my fingernail or whatever, and they'll look at it and they'll say, how long have you had it? They'll ask you some questions, right? And then they can give you, there's a whole set of drugs that they can give you. You can't buy off the shelf, but you don't need to go to the doctor for. You don't need a doctor's prescription.
Yeah.
Some of these are like herbal homeopathic medicines, and some of these are medicines that are definitely over the counter in the US, and some of these are definitely prescription, but kind of light prescriptions, I guess, right, in the US.
Yeah.
Okay. And then your doctor gives you a receipt, a prescription, also, and then you can take it in and get it filled. But there's no like refills. Like I think you just can go back and I say I need another one, and they give you another one unless it's something, narcotics or something like that.
Yeah.
So it's really interesting. And then you pay for, so it depends which kind of insurance you have, public or private. And my wife is public and I'm private, and that's a whole nother long story. But she would just go in and show her insurance card and then walks out with the medicine. There's no money exchanged.
Yes.
For me, I have a little different system. I have to pay, and then I get the receipt. But the receipt is printed right on the code's printed right on the prescription. They give it back to me. They fill it. I scan it with my phone, and a week later, the money goes directly into my bank account.
Yeah, yeah. So you went there to get your booster. So did you have to go to the?
So I had to get the piece of paper. So it's interesting. I went to sometimes the first time I went to get my second vaccination, I got the paper there, and that was at the big local vaccination clinic. This time, if you go to like a doctor's office or a small clinic like I did, they just give you a little paper thing, and you take it to the pharmacy and for free, and then they validate it for you. So now it's in my app, and if I show it, and it's recognized everywhere. It's got a QR code that they can scan, and it pops up and says, "Yep, it's good." And here's the information, and they check your license, and it matches up.
Yeah,
so,
yeah, interesting
systems.
Yeah, yeah. Well, we have a hodgepodge of all those types of things here, as you can imagine. Right?
Yeah, it's much more
states and
here.
Various different counties and municipalities, and it's a real hodgepodge. Now, you said you and Sandy were thinking of coming back to the United States for the holidays.
Yeah, so we have flights Tuesday. So today, just if people are listening to this, it's December 17th, Friday, and we've got flight on I guess that would be the 22nd, Tuesday, to stay for 2 weeks. What's your read? So everything is changeable and refundable, right?
Yeah.
So assume there's no financial cost to saying, okay, we're just going to move these to the spring, right? We can change the tickets to March or something like that, right? What's your read?
So
and we're going to Michigan, which has one of the highest rates, right? We're going to Michigan, and then I have tickets to fly to Florida to go see my mother, right? I'm going to my in-laws.
Yeah.
So Michigan's got one of the highest rates, and Florida, the last I read, was okay, but they're going up. Right?
Yeah. Yeah, there's waves of this going all over the place, right? We're pretty high here. Hospitals have hit 90% capacity, so they've started canceling elective surgeries. Now, when you say 90% capacity, it's a little, you gotta be a little careful here. Hospitals are one industry that has required individuals to be vaccinated, and most of them have not. Again, it's the hospital doing this, not the state or the county or the government. And many of those hospitals have not given any types of exemptions for that. So many hospitals have lost people. So we got this double thing going on. We got this staffing. We've had a nursing shortage here for years, and now we've have not only just an additional nursing shortage because we've lost some nurses and other staff people as well because of their refusal to get a vaccine for whatever reasons. Right, that's their choice. And then this bump up in COVID cases going up, which predominantly appear right now to be Delta. The Omicron thing hasn't really hit in any mass here. And it's what I've been able to discern is that about 70% of the hospitalized population is unvaccinated. And about 30% are vaccinated people. So that seems to be the ratio approximately, probably plus or minus 5% on that from what I've been able to kind of dig up and try to understand. So the unvaccinated percentage is a significant percentage of that. So I think if you're boosted, I haven't seen any data that talks about boosted people and what their sort of susceptibility is. I think my concern, if I was traveling internationally right now, would not really be if I'm going to get COVID or not, particularly if I'm boosted. It would be, can I get back to my home country? In other words, in the next 2 weeks, is Germany going to close its borders? And then can you get back? To me, that's the bigger risk.
Yeah.
Right? Not that you're going to be able to get into the United States, right? Because you're vaxxed, you're boosted. So you can get here. The question is, will you be able to get back to Germany? Is in the next 2 weeks, Omicron or Delta going to take off even more as we get the whole Christmas thing and everyone together for the holidays, and we're going to get a big spike, you know? So that to me would be my worry, I think. Can I get back?
Yeah.
Right?
Yeah. And I also worry about if something happens while I'm there. I mean, I'm healthy, but if I get a car accident or I break my leg or I slip and fall on the ice or, because I haven't seen ice in a long time. Right. But, if something happens, right. Or I get strep throat or something, and the healthcare system, as you said, is kind of all overloaded. And now I'm not really insured. I mean, I have health insurance that covers travel, right? But I don't have U.S. health insurance, right?
Right.
So there's that as kind of my secondary, right? If something else happens, you know, I'm a long way from home.
Yeah. I mean, I think yesterday I heard on the news that it appears that COVID, I don't know what strain, they didn't really specify, as ripping through a bunch of universities. Like Cornell has 900 positive cases.
I saw, and they shut everything down.
But none of them are hospitalized.
Right.
At least that's what I heard, right? Again, the news has gotten
It's hard to get accurate information and know what's accurate. I totally agree. And the same here, too.
Yeah, the news is so noisy. Yeah, it's hard to filter out what's fact and what's, rumor. So, but anyway, yeah, so that's what I guess I would be concerned about, Mike, is something going to happen and the borders get closed and you can't get back? Or getting back will be really difficult, right? And angst producing. So, yeah.
And it's a little more challenging because we fly in and out of the Netherlands, out of Amsterdam, because we live about 45 minutes from the border, and there's a nice nonstop, right? From Amsterdam to Detroit, and that's what we take.
Yeah.
So.
Yeah. I don't know. It's a tough decision.
Know.
I'm glad
I'm going to sit down tomorrow and kind of go through the options and.
Yeah, I mean, Elaine and I are laying low. I mean, we're basically see family direct. We see the kids and the grandkids. Yeah. That's it. We don't socialize. We don't really. We haven't eaten out in a restaurant in 2 years. So we do take home or take out. And boy, it's amazing. I was thinking about this the other day, how the whole takeout for food has really changed. It's got to be a significant percentage of restaurants' business now. And it still amazes me to this day that it's been 2 years now almost. And some restaurants have really figured out how to do it. Man, is it efficient. They have a great app. It works really well. It saves your previous orders. If you want to reorder the same stuff, it's like 2 clicks. It's just remarkable how good it is. And there's other ones. Oh my God. It's like, I want to close the app and call them on the phone. The app is so bad.
Yeah.
It's just amazing to me. Because it's got to represent a significant portion of their business, I would think.
Right. And there's already models that work. So how hard is it to say, I want it to look just like this one, right? Just put my logo and my colors on it and my menu.
Exactly. And some restaurants here haven't even opened. They don't even have indoor dining. I mean, for 2 years, they've been closed since the whole COVID thing. There's a couple of McDonald's around here that just, I think they're all owned by the same franchisee. They have not had inside dining now for, almost 2 years.
And I wonder if they're more profitable.
And I'll tell you, they got drive-through down. Not that I'm a big customer of McDonald's, but man, do they have it down. It's boom, boom, boom. It's efficient. Yeah. They have figured it out. And other places you go to for drive-through, it's painful. And, Elaine will attest to the fact that I don't have a lot of patience for waiting in lines. It's just, some businesses have really got it, man. They've figured this out and they realize how important it is to them.
Yeah. And I'll bet you in some ways you can be more profitable. I mean, you can't upsell and things like that. And you maybe miss some walk-in traffic, right? Or somebody going back for a second
Right.
bag of French fries, right?
Right.
But you don't have to clean the place.
Exactly.
Right? You don't have to worry about extra napkins and all these things. You don't have to clean the bathrooms. You don't have to, extra staffing, all of these things. I mean, you're just doing one thing. Because really, if you think about it, a typical fast food restaurant, you really have two things going on, and they step on each other, right? You got the sit-down business and you got the drive-through business, right? And they're really two separate processes. They have a little bit of shared overlap with the food prep, right? But you got to figure that simplifies their process, right, and makes it more efficient. And they got to be, at least from what I've seen, right. There's always here, at least, right. There's always a line at the fast food places.
Yes. Yeah.
Well, and a bunch of them have added a second lane or a third lane, right? And they've really been able to crank through more volume.
Right.
And I wonder if that more than makes up for the sit-down traffic, because you got to figure a lot of people just taking up space, right? They're hanging out, right?
Yes. Right. Yeah, it's interesting. Well,
right? You don't have to take the trash out, right? I mean, I wonder what their trash bill. I mean, I wonder what at a typical fast food restaurant, what trash removal is every month.
Right. From all the packaging
how much that's gone down, because it's all shifted onto the customer.
That's right. They're not throwing out all that packaging now. You are.
Yeah. I mean, maybe some people are dumping some stuff out of the drive-thru, eating in the parking lot, but I got to think the vast number of people are taking stuff home, and it's no longer the restaurant's problem.
Yeah.
To do trash removal.
Yeah, it's interesting how things have changed, and we still do pick up food shopping, grocery shopping, and here again, I'll tell you. Walmart has figured this out. Man, does it work well? Their app works really well. And I understand, and I figured out that Walmart uses its employees to go around and shop for your food and, pick it off the shelves.
Rather than the third party.
And the other grocery chains here use a third party. Mm-hmm. And there's a difference. I tell you, there's a difference. And so for certain things, what we've done now is for those staple type things that are just, this is the brand we buy it, it comes in a box, whatever. Man, we just do that stuff online, and we pick it up. The whole thing, the trip to pick it up and back to our house is 15 minutes at most. And
you drive in, and then you tell them you're here, right? And I mean, I've never done it because we don't really have it here. I mean, I walk to the grocery store.
Yeah.
So you tell them you're there, you tell them what parking spot or what your license plate number is, and they just bring it. You pop the trunk, right, and they just put it in.
Exactly. It's exactly right. The app actually, you tell them when you're leaving your house, so you're actually giving them a little bit of notice.
Yep.
You tell them, and the app knows, oh, you're here. Tell me what spot. I mean, the app is really smart.
Cool.
It knows I'm at the store, and tell me what spot you're in, what color your car is. And boom, it comes out, and says, come between when you do your shopping, you set up a time.
Right. A window.
Right. And they allow you to edit it. Right. So we typically set up 2 days from now, and it allows you up until I think like 6 hours before or 4 hours before you're actually going to pick it up. It allows you to edit it and change it and add stuff to it. It's really well done.
Nice, but they really manage the flow that way, and they probably can staff better. Again, this might be better than just people going wherever the heck they want, right?
That's right.
It's too crowded, and they run out of stuff, right, or whatever, right? Now they've got a queue, and they can plan their labor better.
That's right.
And they can plan the flow of people in and out so that things are fluid, right? Which has got to, again, they don't have to do peak staffing because they know they're getting X% of their customers are using this drive-through model, and they can literally space it out, right, by having when are the open time slots, right?
Right. Yeah, because they limit the number of slots.
Right. And then they even know, I'm sure they've got, now enough data where they can really predict, weeks out, right, what it's going to look like.
Yeah. So they don't do stuff like that over there?
So the shopping is just so different here. And again, there's probably other cities. I know they do more. There's a couple of companies, German companies, that have hopped into the grocery delivery space in Berlin and in Hamburg, some of the bigger cities. In our city, we have 300,000 people, but in a very small footprint. And so we have a couple of kind of big grocery stores that people drive to, right, that are kind of more in industrial zones, right? They aren't in the residential areas.
Yeah.
But then the vast majority of grocery stores are small. So the footprint is much smaller, and they're more kind of neighborhood grocery stores. And the vast majority of people walk to them. We've got some in our neighborhood. There's not even a place to park if you wanted to. Only biking and walking right to the grocery store. And it's small. It's a little bigger. It's probably halfway between like a big Walgreens and a small, Price Chopper or whatever you got up there.
Yep.
Right.
Yep.
And so, and there's some different variants of that. So like we live in a bounty. One of the things we love about our neighborhood is we have a bounty of grocery stores. We've got within literally a 5 or 6 minute walk, we've got 2 kind of like mini Whole Foods, so organic kind of natural grocery stores, right? We've got 1, 2, 3, 4, 5, 1, 2, 3, 4, 5 kind of not huge grocery stores, but kind of full size grocery stores. 6.
Wow.
Within 7-minute walk.
Wow.
Okay. And 2 of them, one's Aldi and one's Lidl, right? And know Aldi, right?
Yep, sure.
The discounters. And then we've got another brand called Reva, and that's kind of a mid-priced grocery store, kind of like a Price Chopper, I think. You're right, you have Price Chopper there.
Yeah, we do.
If I remember correctly. But like a Safeway or not a super big one, but a kind of a small regional chain, right? Or national chain. And they have Reva all over Germany. And they've made a couple of acquisitions. So there's like 4 in the neighborhood, and I think 2 were one and 2 were the original, and 2 were bought a few years ago. And then we've got these 2 other kind of regional chains that are those you can ride your bike to. That'd probably be a 20-minute bike ride. But that's where we'll go once a month and do a big shopping and take the car.
Yeah.
So kind of once a month we'll do a big shopping and take the car, and they have kind of big parking lot, and they're still not quite as big, and they do have stuff. Both of these 2 have kind of stuff and groceries, so kind of like Meijer if you're in the Midwest, or like a Super Target, right? Like when they have or a Walmart, right? Where they have both food and stuff, but still smaller than like a Super Walmart, right?
Yeah.
But they have both, and so those we go like once a month, but twice a week. And our fridge is smaller. Like everybody has smaller refrigerators. And we don't have storage space. So before COVID, we went to the grocery store 3 times a week. And now I do kind of 1 larger every week and maybe 1 little small one. So definitely down to 2 or kind of 1.5.
Yeah.
So there in that model, and there's not much need for grocery delivery and pickup, right? Because everybody's just kind of walking anyways, and the stores are smaller.
Yeah.
But I do know in some cities there are a couple of places where you can do a grocery delivery, but it's not as common.
Yeah.
I mean, as it is right now. But it's funny, there's no express lines. Okay. My grocery store. And when my mother-in-law, maybe I told you the story, but when my mother-in-law was here visiting before COVID, she got mad. And I'm like, what's the matter? And she's like, there's no express line. And I'm like, the whole thing's an express line, right? Everybody's putting it in their backpack or carrying it home. Nobody's got these, the carts are small, and nobody's got a full cart. Everybody's got like 18 or 20 items, right? Yeah. I'm like, the whole place. And she's like, she looked around. She's like, you're right. Right. And I'm like, yeah, it's just a different model of grocery shopping.
Yeah. Cool. Well, I hope you guys figure out what you're going to do on your trip. That's not an easy decision, right?
What would you do? Go or push?
Well, I'll tell you, I think that if it was Elaine and I, knowing how sort of conservative we are about these types of things, we would probably not travel. There would be a lot of angst about it because family is really important to us, and we really enjoy seeing family and doing all those things. And we're so thankful that we live relatively close to family, right? We're 20 minutes from one son and the granddaughters, and a 4-hour drive from the other one. So that's really, it works out well for us. But yeah, I don't know. I'm down on traveling. I don't mean I'm down on it, but I'm very cautious about traveling. And it makes me anxious. It makes me nervous. So it's not an enjoyable thing. If you understand what I'm saying, right?
Right. Like it used to be.
Yeah, I used to love traveling.
You're all excited, right? Exactly.
Yeah, I have over 1 million miles on American Airlines. So I mean, I have traveled a lot, and I used to like it a lot, and now I'm anxious about it. I'm nervous about it. You know, even when I'm driving, you're stopping at the rest area, and I'm like, you know, it's really changed. So
Yeah.
I don't know. I think this notion of, you know, of life in a community, the value of that is, at least in our minds, is increasing, right? As opposed to this, let's take the family and scatter it all across the world, which was a model that worked very well and it had a lot of advantages. And it still works, but you have constraints, right?
Yeah, that we see.
Right. You might not be able to see everyone as often as you like, right? So, you know, probably pre-COVID, you might come to the States 2 or 3 or 4 times a year. And now it's, you know, maybe once every other year.
Yeah.
So yeah, it's,
Yeah,
I don't know.
When we went
Mike.
in August, we were in the kind of the well of the
Yes.
of the wave, right? So it was still a little risky, but a lot less than right now. And yeah, and it's hard to predict.
Yeah, and I think that, like you said, the risk is for unforeseen events, right? I don't think the risk is that you're going to get COVID, right? You're boosted. I'm pretty confident about that. The risk is the borders get closed, or like you said, you have an accident or get something else, and you have to go to the hospital, and
And I also, now, you know, all of our direct relatives and our direct friends are vaccinated, but I don't know about boosted. And, you know, the other thing, when I'm you know, flying through Amsterdam airport, right? And that's where there was that early kind of wave of Omicron was detected there. And, you know, I don't want to also carry something. I mean, I know, you know, the science suggests that the load is smaller when you're vaccinated, but it's still feasible, right? And,
you're definitely,
you know, so
you're
that's kind of
definitely a carrier if you're vaccinated.
Yeah.
That's clear. It may be not as
the
strong a carrier, but you're still a carrier.
Right. And that's the third level of, you know, it's not myself so much that I'm worried about too, but I don't want to create a problem somewhere else in the world, right? From bringing something from Europe over.
Right.
You know?
Yeah, exactly.
Well, I'll let you know what decision I make, but I appreciate your wisdom as always.
Yeah, well, yeah. Well, all right. That was good, Mike. Always good to catch up.
Yeah. I'm glad you're doing well.
So thanks for listening. Hope you enjoyed that. Let us know what you think. We always like hearing from our listeners. Take care, and thanks again.